Good morning, students. Today we'll be studying about the front, back and adductor compartments of the thigh. This is Dr. Yusuf from Al University. These are the specific objectives related to this topic which are covered in the Al University in different sessions like the PBL sessions, lab, lectures, seminars and STLs. So these are the nine topics, nine specific objectives which are related to this topic. To begin with, the thigh. The thigh is the region which extends from the hip joint to the knee joint. So it extends from the hip joint here to the knee joint. This whole area is called as the thigh. So this thigh, if you see the cross section, if it is taken in the cross section, this is how it looks like. Okay, so when we see the thigh, and for the simplification of the study, we divide it into three compartments, that is the anterior compartment, the posterior compartment and the medial compartment, and these compartments are separated by a modified deep fascia which invaginates inside between this compartment. This is called as the intermuscular septum. Intermuscular septum separates these three compartments. So intermuscular septum is nothing but the modified deep fascia which is present between the compartment. So the largest compartment here will be the anterior compartment, and there is a posterior compartment and a medial compartment. Always when you study the upper limb as well as the lower limb, you should keep on comparing the upper limb with that of the lower limb. If you see the upper limb, the thigh is related to the arm, and in the arm also we see actually there are three compartments, even though there is an anterior compartment which is called as the flexor compartment and a posterior compartment. There is also an additional compartment, very small compartment, formed by the muscle coracobrachialis. So the presence of the coracobrachialis on the medial side indicates the medial compartment, which is very similar to the thigh where we have the three compartments. To begin with, we'll study each compartment one by one. The first compartment is the front of the thigh, which is also called as the anterior compartment, or it is also called as the extensor compartment of the thigh. If you recall, in case of the arm, the anterior compartment is also called as the flexor compartment, but here the anterior compartment is extensor compartment. So this anterior compartment in case of thigh is supposed to be correlated with the posterior compartment of the arm, that is the extensor compartment of the arm. Why? This is because if you see the actually during development, the arm has rotated outwards by 90 degree and the thigh has rotated medially by 90 degree. So it is totally opposite to that of the upper limb. So in case of the upper limb, the arm, the posterior compartment is extensor compartment, but here in case of the lower limb, that is the thigh, it has totally rotated, so the posterior compartment has come to the anterior compartment. So actually the anterior compartment is the extensor compartment in case of the thigh. So this the muscles in this compartment extends the knee. You should remember, if it is the extensor compartment, it extends the knee, not the hip joint. It extends the knee joint. That is the thing you should remember. Okay, so this compartment extends from the, as I said before, it extends from the hip joint to the knee joint, and it corresponds to the back of the arm. As I said, the back of the arm or the posterior compartment of the arm. Now we'll study what are the muscles which are present in this compartment or the front of the thigh. The first muscle is the Sartorius muscle. So if you see here in this picture, there is a muscle here which is also called as the talar muscle, long strap-like muscle which extends from the anterior iliac spine. Here it has been cut to see the deeper muscles here, so actually it will be complete to the complete muscle which extends from all the way from here up to the beyond the knee and go up to the tibia. So this is the first muscle, which is also called as the Sartorius. Here we, on the other side, the same arrangement of muscle have been shown with the cross section. So here there is cross section, so you can see all the muscle and you can see the three compartments. This is the anterior compartment here, this is the medial compartment, and this is the posterior compartment. Okay, so what we are studying are the muscles in the anterior compartment. The first muscle here is the Sartorius. So here will be the Sartorius on the medial side. Begins from the lateral side, goes to the medial side. We'll study this again in detail later. First, we'll name what are the muscles which are present in this compartment. The first one is the Sartorius, as I said. The second is called as the quadriceps femoris. Quadra means 4, ceps means heads. So it has 4 heads. So this is called as the quadriceps femoris. If you recall, in the actually the gluteal region, there is also a muscle called as the quadratus femoris. So you should remember, you should be able to differentiate between the quadratus femoris and the quadriceps femoris. Quadratus femoris is present in the gluteal region, and the name quadratus has come because of the quadrilateral shape of that muscle. But here, this in case of the front of thigh, we have quadriceps femoris, not quadratus, but it is quadriceps femoris, where it means quadra means 4, ceps means heads. So it is thought to be a single muscle, and it has 4 heads. But some other call each of these muscles as separate muscle. So we have put both the quadriceps femoris under a single heading, and we have named the 4 muscles also here. So you can take it as a single muscle, or you can take it as 4 muscles, because the origin of these muscles are different, but they all get inserted to this base of the patella here. So because they all come and get inserted to this base of patella, so it is thought to be the 4 heads which are coming and getting inserted to the particular point. So this is the quadriceps femoris. This quadriceps femoris has 4 parts, or the 4 muscles. The first one is called as the rectus femoris. This is the muscle here which is present in the front of the thigh. This is called as the rectus femoris. Then we have the vastus lateralis. On the lateral side, this is the muscle which is called as the vastus lateralis. Then we have the vastus medialis on the medial side, and in between the lateralis and medialis, behind this rectus femoris, there is vastus intermedius. So if you cut this rectus femoris, then you can see the vastus intermedius. If you see this cross section, here you can see the vastus lateralis, this is the vastus medialis, this is the rectus femoris, and behind this rectus femoris is the vastus intermedius. So these are the 4 muscles which are together called as the quadriceps femoris. The third muscle is a small muscle. This is called as the Articularis genu. So there is a small muscle here which is called as the Articularis genu. And the 4th muscle is the tensor fascia lata. Tensor fascia lata we also study in the gluteal region. Some classify it as the muscle of the gluteal region, the superficial muscles which are the gluteus maximus and the tensor fascia lata, and some classify it under the front of thigh because it is on the side. Okay, so you can either take it as it is a common muscle, you can say, between the front of thigh and the gluteal region. So these are the 4 muscles which are part of the front of thigh. One is the Sartorius, the first muscle. Then we have the quadriceps femoris, which include the rectus femoris, vastus lateralis, vastus medialis, as well as the vastus intermedius. Then there is a small muscle called as the Articularis genu, and then the tensor fascia lata, which is a common muscle between the gluteal region and the front of thigh. All these muscles are supplied by a single nerve. This is called as the femoral nerve. So all these muscles are supplied by the femoral nerve, and the arterial supply to all these muscles is by an artery called as the femoral artery, and the venous drainage is by the femoral vein. So everything is femoral here. All these muscles are supplied by the femoral nerve, femoral artery, and these are drained by the femoral vein. So now we'll study these muscles one by one in detail. The first muscle is the Sartorius. So here you can see the whole muscle. This is the Sartorius muscle. This is said to be the longest muscle in the body. So as I said before, so all the structures in the lower limb are bulkier, thicker, larger, longer, thicker, everything. So so whatever you want to see, the thickest muscle, the sciatic nerve, will be present here. The longest and the thickest bone here, you can see the femur, and here the longest muscle is also present here. The longest nerve is present here. So all these longest, thickest, biggest will be present in the lower limb compared to the upper limb. Okay, so this is the longest muscle in the body, and it is an example for the ribbon or strap muscle. It looks like a ribbon tape. Okay, it looks like a ribbon, or it looks like a strap, and that's why it is also called as the tailor muscle. This is also called as tailor muscle because it looks like the tape of a tailor, or it looks like a strap or ribbon, or the actions of this muscle help in sitting, the squatting position of a tailor who is to sit on the floor in traditional system. In that time, the movement which are needed for the squatting on the floor, that will be done by this Sartorius muscle. That's why it is also called as the tailor muscle. The origin of this muscle is from a structure here. This is called as the anterior superior iliac spine. This is the iliac crest. The most anterior part of the iliac crest is called as the anterior superior iliac spine. So this is the point where this muscle take origin. So it takes origin from the anterior superior iliac spine. Here also you can see the anterior superior iliac spine, and it get inserted to the upper part of the it gets inserted to the upper part of the medial surface of the shaft of the femur. It crosses the hip joint and the knee joint, then it goes down and get inserted to the medial side of the tibia. And along with this muscle Sartorius, there will be also a muscle called as gracchalis as well as semitendinous. All these three tendons will be inserted at this particular point. So this is the medial side of the shaft of the tibia. Okay, so this is the long muscle which take origin from the anterior superior iliac spine and get inserted to the medial side of the tibia. While it crosses the knee joint, it also gives some fibers to the capsule of the knee joint above and the crural fascia below. So this muscle gives some fibers even to the capsule of the knee joint. Nerve supply, as you know, is by the femoral nerve. The root value is L2 and L3, and the actions are, one is the flexion of the thigh. Even though this muscle is in the extensor compartment, it helps in flexion of the thigh and the flexion of the leg, and abduction of the thigh and the lateral rotation of this thigh. So even though it is present in the extensor compartment of the thigh, anterior compartment is also called as the extensor compartment here, but it actually flexes the knee joint as well as the hip joint, and also it helps in the abduction of the thigh as well as the lateral rotation of the thighs. This combination of four movement is done when you sit on the floor in the squatting position. So the traditional tailors used to sit on the floor and they used to do all their cuttings. So that's why it is also called as the tailor muscle, because for the tailor to sit on the floor or squatting position, these are the four actions needed, and these are done by the Sartorius. Now coming to the second muscle, that is the quadriceps femoris. As I said, quadriceps femoris has four muscles. The first one is the rectus femoris, which is the most anterior. Here you can see here this is the rectus femoris. Here you can see the cut section of the same. So this is a fusiform in shape, and superficial fibers are bipinnate and deep fibers are straight. If you see here, the superficial fibers, bipinnate means they are in two directions. The fibers, if you can see here, they are in two different directions. This is called as the bipinnate. So the superficial fibers are bipinnate, and if you see the deep fibers, they are straight. The origin of this muscle is from the anterior inferior iliac spine. So it has two heads, the straight head as well as the reflected head. The straight head takes origin from the anterior inferior iliac spine. So if you see here, the Sartorius take origin from the anterior superior iliac spine, and this straight head of the rectus femoris take origin from the anterior inferior iliac spine. And the reflected head takes origin from the groove above the margin of the acetabulum as well as the capsule of the hip joint. So near the acetabulum, behind, just above the margin of the acetabulum, as well as from the capsule of the hip joint, this reflected head of the rectus femoris will take origin. So it has two heads. One head, straight head, takes origin from the anterior inferior iliac spine, and the reflected head from the groove above the acetabular as well as the capsule of the hip joint. The insertion of this muscle, as I said, all this muscle of the quadriceps femoris will get inserted to the base of the patella. If you see here, this is the patella. It is almost pyramidal in shape with the base directed upwards here, and the apex is directed downward. So this is a reverse pyramid like structure. So the base is on the top here. Okay, so this will get inserted to the base of the patella. Nerve supply, as you know already, it is by the femoral nerve. Root values L2, L3 and L4, and the actions are, one is, as you know, the extension of the knee joint, as you know, because it is the muscle of the external compartment, so it indicates that it is the extensor of the knee joint. So it helps in the extension of the leg, and also a weak flexor of the hip joint. So it flexes the hip along with the iliopsoas, as well as maintains erect attitude with extensors. Coming to the second muscles of the quadriceps femoris, that is the vastus lateralis. So this is the muscle which is on the lateral side. Here on the other side, this is the vastus lateralis. So this is the largest of the quadriceps muscle, even though it looks very small here. If you see the cross section, then you can appreciate how big it is. So this is the cross section, and here you can see with the first muscle you have studied is the rectus femoris. Now you can see this is the vastus lateralis. This is the lateral side, this is the femur here. So this is the vastus lateralis, this is the vastus intermedius, and this is the vastus medialis. So this is the vastus lateralis. See the size of the muscle. So this is the largest of the quadriceps muscle. This here, it looks small because it is totally covered by the rectus femoris. So the origin of this muscle is from the upper part of the intertrochanteric line. So where is this intertrochanteric line? We'll see this picture and then we'll appreciate this. Okay, so if you see here, this is the greater trochanter of the femur and this is the lesser trochanter. In the front, we have something called as the intertrochanteric line, the line extending from one trochanter to the other trochanter. So this is called as the intertrochanteric. Inter means between the trochanters. So in the front, if you see from the front of the femur, so you can see a line between the two trochanters. This is called as the intertrochanteric line. If you see from behind, at the same point from behind, so at that time you can see a projection between the two trochanters. This is called as the intertrochanteric crust. So you should be able to differentiate between the intertrochanteric line and the crust. Intertrochanteric line can be seen from the front and the intertrochanteric crust can be seen from behind. This is the view taken from behind the femur. Okay, so this muscle will take origin from the upper part of the intertrochanteric line, from here, the upper part of the trochanteric line. Appreciate this with this picture here. Here they have shown you the origin of the vastus lateralis. So it takes origin from a part of the upper part of the intertrochanteric line, then also the anterior and inferior borders of the greater trochanter. Where is the anterior and inferior border of the greater trochanter? So this is the greater trochanter here. So this is the greater trochanter. Just below that will be the anterior. This is the anterior because this is anterior view, anterior and inferior. Below the greater trochanter, this is the inferior. So here you can see. So this is the anterior and inferior borders of the greater trochanter. Then the lateral lip of the gluteal tuberosity. So where is this gluteal tuberosity? If you proceed backwards, then you can come along a line here. This is a small projection. This is called as the gluteal tuberosity. So this is the gluteal tuberosity where the gluteus maximus is inserted. Actually, if you see the gluteus maximus, 3/4 of the muscle will get inserted to the iliotibial tract. Only a part, 1/4 of that will be getting inserted to the femur, and this is the point where it will be getting inserted. This is called as the gluteal tuberosity. So it extends along this line. So here you can see the same thing, the origin of the vastus lateralis. So it begins from the anterior side and goes behind, and this is the line along which it will be taking origin. Then the upper half of the lateral lip of the linea aspera. Where is the linea aspera? If you trace behind, there is a posterior border very clearly prominent. This is called as the lineal aspera. So this is the linea aspera, which has a lateral margin, a medial margin. So this muscle will be taking origin along this line also. So it will be taking origin along the lateral margin or the lateral lip of the linea aspera. Then the tendon of the gluteus maximus as well as the lateral intermuscular septum. So because the gluteal tuberosity, there is the tendon of the gluteus maximus, that's why this muscle also takes from the origin from the tendon of the gluteus maximus as well as the intermuscular septum. If you can see here, this is the intermuscular septum. This is nothing but the modified deep fascia which separates the anterior compartment from the posterior compartment. This is called as the lateral intermuscular septum. So this muscle also takes origin from the lateral intermuscular septum. So this is a very big origin. It takes origin from the upper part of the intertrochanteric line, then the anterior and inferior border of the greater trochanter here. Then it also takes origin from the gluteal tuberosity here, and then it also extends below on the lateral lip of the linea aspera, as well as small origin is also from the tendon of the gluteus maximus as well as the intermuscular septum. This is the lateral intermuscular septum. So this has a very big origin. This is the vastus lateralis. Now coming to the insertion, as you know, it again get inserted to the base of the patella. If you can see here, this is the patella, this is the base of the patella, and you can see here this is the rectus femoris which is getting inserted, and here is the vastus lateralis. So it get inserted to the lateral 2/3 of the base of the patella, as well as even on the upper 1/3 of the lateral border. This is the lateral border of the patella. Okay, this is the medial border here, this is the lateral border. It not only gets inserted to the base of the patella, 2/3 of the base of the patella, but also on the upper 1/3 of the lateral border of the patella. And some of the fibers also go to the capsule of the knee joint, tibia as well as the iliotibial tract. So this is about the insertion of this vastus lateralis. Now coming to the nerve supply, as you already know, nerve supply is by the femoral nerve, and the actions also you know, that is the extension of the leg or extension of the knee joint. Now coming to the third muscle, that is called as the vastus medialis. The origin of this muscle is from the lower part of the intertrochanteric line, just opposite to that of the vastus lateralis. So vastus lateralis will be taking origin from the upper part of the intertrochanteric line. Now this will take origin from the lower part of the intertrochanteric line. If you can see here in this picture, this is the origin of the vastus medialis, just opposite toward the vastus lateralis. So it takes origin from the lower part of the intertrochanteric line. Then it also takes origin from the spiral line. So this intertrochanteric line will continue behind as the spiral line. If you can see here, this is called as the spiral line, or it is also called as the pectineal line, because the pectineus muscle will get inserted to this point. So that is called as the pectineal line, or it is also called as the spiral line. Okay, because it is spirally placed. Okay, so this is the origin. Then it also take origin from the medial lip of the linea aspera. So the vastus lateralis was taking origin from the lateral margin. Now this will continue below from the medial margin. So it is just opposite to the vastus lateralis origin. And the upper 1/4 of the medial supracondylar line. So it also continues below up to here, and it takes origin in from the upper 1/4 of the medial supracondylar line. and the tendons of the adductor longus and magnus and the medial intermuscular septum. So all these muscles are present here. So it takes origin from the tendons of all these muscles, that is the adductor longus, magnus, as well as the medial side of the intermuscular septum. So this is the origin of this muscle. Okay, so from the lower part of the intertrochanteric line, then it continues behind from the spiral line. Here you can see here it continues behind in the spiral line, then it continues on the medial lip of the linea aspera. So it will continue in the medial side. You can see here this is the origin of the vastus medialis, and it continues below and it goes up to the supracondylar line. So it has a very big origin. This is the vastus medialis. Now coming to the insertion, as you already know, it get inserted to the base of the patella, but on the medial side. Okay, so medial 1/3 of the base of the patella, then also on the medial border, almost 2/3 of the medial border of the patella. Vastus lateralis get inserted to only 1/3 of the lateral border of the patella, but here the vastus medialis get inserted almost 2/3 of the medial border of the patella. This has a very important significance, that it prevents the lateral dislocation of the patella. Okay, that's the importance of being 2/3 inserted to the medial border. So it prevents the lateral dislocation of the patella. Usually whenever there is dislocation of patella, it will be on the lateral side. So this muscle, vastus medialis, will prevent the lateral dislocation of the patella. Along with that, some of the fibers also go to the capsule of the knee joint. So this is the insertion of this vastus medialis. Here we have to note here. So if you can see here, this the tendon of the quadriceps femoris. So all these muscles, the rectus femoris, vastus lateralis, medialis, as well as intermedius, all this will come and get inserted to the base of the patella, and this will continue below as the patellar ligament. And this patellar ligament will be getting inserted to the tibial tuberosity. There is something called as the tibial tuberosity on the anterior surface of the tibia, anterior and superior upper part of the tibia, that is called as tibial tuberosity, and this patellar ligament will get inserted to the tibial tuberosity. That's why it looks like 4 heads. All this get inserted here, and it continues as the patellar ligament get inserted to the tibial tuberosity. That's why it is called as the quadriceps. It is thought to be a single muscle. Okay, so this is the patellar ligament here, which is present. And coming to the nerve supply, as you already know, it is supplied by the femoral nerve, root value of L2, L3 and L4, lumbar 2nd, 3rd and 4th. And the actions you already know. One is the extension of the knee joint, that is the extension of the leg. Along with that, it also prevents lateral dislocation of the patella. As I said, the patella will be getting inserted on the medial border by 2/3 by the vastus medialis. That will prevent the lateral dislocation of the patella. So if you see the patella here, this patella is seen to be a bone within this tendon. So that's why it is called as the sesamoid bone. Sesamoid bone are those small bones which are within the tendon of the muscle. So this is said to be the largest sesamoid bone in the body. Okay, so this is the sesamoid bone. The patella is a sesamoid bone. The sesamoid bone is that bone which is within the tendon of any muscle. Okay, so the patella is said to be the largest sesamoid bone in the body. Now coming to the vastus intermedius, the last muscle of the quadriceps femoris. So the origin of this muscle is from the upper 3/4 of the anterior and lateral surface of the shaft of the femur. If you can see here, vastus lateralis take origin from this part, only small part here I am anteriorly, and the vastus medialis again from the medial side, very small part. But if you see the vastus intermedius, so it has a very big origin on the anterior surface as well as the lateral surface. If you see this picture of the cross section of the thigh, you can appreciate this is the femur. So you can see here it is taken, this is the vastus intermedius. It has a big origin from the anterior surface as well as the lateral surface. Okay, so that's what it has been said here. So this is the anterior surface and this is the lateral surface. So this vastus intermedius take origin from the upper 3/4 of the anterior and lateral surface of the shaft of the femur. So if you can see here, below it is 1/4 is deficient. Okay. So the lower part of the, this also take origin from the lower part of the lateral intermuscular septum. If you can see here, the lateral intermuscular septum, it also take origin some of the fibers from the lateral intermuscular septum. Coming to the insertion, again this is also like any other quadriceps femoris, this also take get inserted to the base of the patella. Coming to the nerve supply, you already know femoral nerve, and the actions also you know, the extension of the knee joint, that is the leg. Now coming after the quadriceps femoris, the last muscle, that is called as the articularis genu. It is a very small muscle with few muscular slips behind the quadriceps femoris. If you see here in this picture, so this is the small muscle which is present in the lower 1/4 of the shaft of the femur. A very small muscle with few muscular slips behind the quadriceps femur. This is the quadriceps femur, big muscle with 4 heads, and this is a small muscle. This is called as the articularis genu. So this will be taking origin from the anterior surface of the shaft of the femur, almost 2 inches above the patellar articular margin. Almost, if you measure from here, it will be almost 2 inches above the patellar articular margin. The insertion of this articularis genu is into the upper part of the synovial membrane of the knee joint, which bulges as suprapatellar bursa. If you see here, so this is the knee joint here, and there will be a small bursa here, a bursa which will be communicating with the knee joint. So this synovial membrane, which is in the knee, covering the knee joint, also covers the bursa, and this muscle will be getting inserted to the synovial membrane as well as into the suprapatellar bursa, and this prevents the kinking of this bursa into the knee joint during the movement of the knee. So prevents the kinking of the synovial membrane within the knee joint. So that's the importance of this small muscle called as the articularis genu. Coming to the nerve supply, as you know already, it is by the femoral nerve. So because this muscle is a very small muscle, the fibers to this muscle will be coming through the femoral branch, which will be supplying the vastus intermedius, because this is the vastus intermedius, big muscle here. So the fibers which come to here, they also come and descend and supply the articularis genu. So we'll discuss this again in detail when you study the femoral nerve. Coming to the action, as I said before, it pulls the synovial membrane upwards during extension of the knee. When